Good morning. Is this all right? We're good. Okay. You are sending me on a roller coaster of emotions this morning, right? The poem was just spectacular, and seeing our folks that have passed. I wish we have folks from Johnson City that have passed that were child advocates this year, and you guys, I'm going to try to do my best. I'm going to pep it up, but that poem really helped. I was really down for a second, but I'm really excited to be here and talk to you all about the Child Friendly Cities Initiative. My name is Sam Pettyjohn. I go by Dr. PJ. I'm very formal, so please. But Sam is great. So a few things about me, maybe they weren't in there. I didn't realize I had so much in common with our commissioner. I have 3 little kids, 5, 3, and 22 months. The youngest is our first foster son. We're in the foster program. We've become huge advocates for foster care, living that as a parent, and so I get to see all the same initials I see on all my stuff as a foster parent up here, and it's really exciting to be here with folks that are doing that work. But I'm also a failed poet, so I was an English major. So I mean, there's a lot of things happening here. There's a lot of happenstance. It's pretty cool. Anyway, we're going to talk today about the Child Friendly Cities Initiative, and I'm going to do my best to use. Is this the advancer? I'm sorry, I should have checked on that. Sorry. Big green button. Oh, so easy. Thank you. All right, amazing. All right. So the Child Friendly Cities Initiative is a UNICEF child rights-based approach to how local government makes decisions and making sure they're including children, folks that are typically not heard of or heard from in governmental processes. And the idea is to create an action plan that ensures the rights of children are carried through throughout. And let me give you a little piece of actually speaking advice as well. If you have small children or there's small children on your team, you don't need photo releases to use them. So we're going to have all the staff from Child Friendly Cities, basically their photos are in this presentation. The 2 little girls with the hard hats, this is the breaking ground of a new adventure park they put in Johnson City. Those 2 little girls are the daughters of our librarian for Johnson City, and she is on our Child Friendly Cities staff as well. So the whole idea is to try to elevate the voices of youth in local governance and decision making. And this is a program there's 4,000 child-friendly cities in the world. We are one of 6 pilot cities that are in the United States. And we argue about if we're the smallest one, we're pretty close. There's a county in the Atlanta metro that's doing this as well, and they argue they're smaller. But if you look at them, they're a very small footprint in a city. We are kind of what we call a micropolitan area, if you want to get into the public health nerdery of how we determine areas. We are a small city surrounded completely by rural areas. But anyway, so we're one of the first 6 cities, and there are 4,000 in the world. We're really excited to be doing this. It's all about the idea of advocating for children's rights. There are 5 basic children's rights, and you can hold up your hand. That helps me remember, and so I put it in here too, so you can learn like I learned. So children's right to safety and inclusion, right to participation in activities, in having say, children's right to essential services, a children's right to play, basically all the fun stuff about being a kid, and a children's right to habitat, to be homed. And this is my daughter in our home. Man, that house is a mess. Anyway, she's in the kitchen there showing us a salad that she made. So she's playing, she's advocating for the 4th right of children there. And there's a minimum criteria to be a child-friendly city. You need to be able to demonstrate the results are actually affecting children within 3 of those rights. Children participate in the process throughout. And then you have to make sure that you put this in an anti-discrimination lens as you do so. And this is my son, Bert. He is an expert. Don't break the ice player. He's showing off there. And so you do this through a number of steps. The first step is the child equity profile. This is one of the things that I was brought in to do. I am a doctor of public health. Very much analytics is, if you know anything about public health, it's all about population numbers. It's all about kind of teasing out statistics. And so I was brought in initially to do this kind of governmental assessment. This is all publicly available data that we use. This is US Census data, National Center for Education Statistics, and then we partnered with Johnson City Schools. We have a very good relationship with Johnson City Schools. I'm just very, very impressed with all the things they've helped us with on this. And we had access to some of the school data, school population data to do this. But things we looked at, this is just some examples we're going to get into here in a second. For instance, household percent poverty type for Johnson City. What we're looking for are outliers, places of inflection, right, where we can make change that will influence the most people the most, is how I'd like to say it. So if we look here, we're talking about poverty type in Johnson City. We know that our single parent, our female single parents with kids under 6, just over 50% of them fall under the poverty line. And so anything we do, we want to make sure that we're going to continue to advocate for those families in particular. We also know that we have a large percent of people's household income is being spent on rent in Johnson City in particular, which is not unusual, but it's just a problem that continues to get worse. And so it's something that we're aware of too, that housing insecurity is something else a lot of folks are dealing with. And so we're taking that lens as well when we look for innovations and projects. Oops. There we go. Interestingly, I think you see this more and more, but we know in Appalachia this is especially a problem. And it's, by the way, it's Appalachia if people don't know. So anyway, people always say, you're saying that wrong. No, no, no. If you're from Appalachia, I don't sound like I'm from Appalachia. I've been there 7 years now. Appalachia. So anyway, one thing that is very particular to Appalachia is this idea of a lot of grandparents raising children especially, we see. And there's direct links to this both culturally and also due to the opioid epidemic, which is another reason that I've kind of into this project is this is seen as the potential for some kind of community-based recovery from the opioid epidemic. And we see that we have a lot of grandparents that are responsible for our grandchildren in Johnson City. So after we've done that initial kind of top-level data analysis, we kind of look for points for intervention within our city, we did a qualitative, two quantitative projects, excuse me. So 2 quantitative projects where we actually did surveys of parents of children of under 5 in Washington County, Tennessee, and Johnson City high school students. And I think, do you go next? I think you're up. Ah, yes. And Kylee did an excellent job running all of our high school focus groups. We did 7 focus groups in classes, 2 in English, or 5 in English, 2 in Spanish, and we digitized this using open source survey collection data called REDCap, another kind of public health artifact that we can bring to this project, and Kylie's going to talk a little bit about her population now.
So this is the biggest thing that I do. If we are going to be face-to-face in front of adolescents, I'm there.
Yes.
So with this, we really wanted to make sure, before we even collected any data, before I even tried to get any youth talking at all, most of you probably understand, if you're talking to high schoolers that maybe don't necessarily want to be there, we have to first establish some sort of connection with them. So before we did anything related to our data collection or discussions, we first did an icebreaker, and it did get a little violent with students running all around the room trying to win. So thankfully, nobody was hurt. Yes. But that was a very important step that I just first want to emphasize, is that in everything that we do with this data collection with youth, we want to first connect with them. So then we went on with just giving them the survey. And so the survey that we were given and that we gave them is from UNICEF's CFCI official. So it's a brief, about 20-question survey that just goes over the 5 rights areas that Dr. Pettyjohn was discussing. It asks questions like, do you have a place to play? Do you have green space? Do you feel safe in your school? And then we would take all of that data, they would quickly just put it into their computers, and we would collect it, and then my assistant would go and just put all the answers on the board. We went from there, and we discussed. So just a little bit of background on that. So our findings. I just wanted to highlight a few in particular. I am informed how government resources to support young people are spent. About 11% said mostly true. We had just under 50% say sometimes true, and 40% say never true. If we expect youth to be involved with the city and to advocate for themselves, to give them the support and the ability to do that, to help lift them up, how can we do that if we're not first informed? I have meaningful opportunities to voice my ideas and concerns about decisions that affect me in the city. About 18% said mostly true, about 50% said sometimes true, and about 32% never true. I help lead actions to change my school, community, or the city. Only 10% said mostly true. About 52% said sometimes true, and 38% never true. So what can we do? How do we go from there? So after we collected all that data, as I said, we had a discussion. So based on all the questions that you were asked, how do you feel? What do you want to see? How can Johnson City better support your rights now that you have even been taught that you have rights to begin with, rights that are separate from your parent? So some statements that came out of this, I knew children already had rights, but I didn't know their rights specific to or more focused on children, and we need to protect each other's rights. So a few themes that came out of this, and again, this is where connection is so important. Youth really opened up. So in every single one of these focus groups, one of the key themes was mental health. We have a question where, do you have access to mental health services? And youth primarily said no. Part of that was transportation. Part of that was economic access. Part of that was they didn't even know where to turn to. So are we truly supporting our youth if these are the answers that we're receiving? And another common theme that came up, again, in every single session, youth were incredibly concerned about their peers and the issue of homelessness in Johnson City. Youth wanted to find ways to support our unhoused population. Youth wanted to find ways to make sure that their friends, that the students sitting right next to them, were fed and taken care of and had a roof over their head. Youth wanted to make sure that I walked away from these sessions knowing how important that was. We'll be on to population 2.
Yeah. So again, so I always look at these things through the lens of ease. And so one of the questions we had for our second population is, we didn't want to go out and try to recruit folks to talk to. It's better to find a group of people that already kind of exists in a list or exists, they all meet together, or they have something in common that gets you where you want to be. That's just, that's lazy data science, and that's my expertise. So we wanted to find some way to tap this population of 0 to 5 children. And gosh, you know, our patron saint of Tennessee, Miss Dolly Parton, has the Imagination Library. And it turns out that every library at the county level has a list of the folks that sign up when they are at the hospital for the Imagination Library. And that is a list that is otherwise very secure, untapped. We don't use it for advertising. We don't use it for anything. It's just a list that the library has because the library is very responsible for coordination. And so we determined that maybe the best way to talk to parents of children that are 0 to 5 in Tennessee was to access the Dolly Parton Imagination Library list, and we sent the survey out through that list, and it was wildly successful in the sense of survey science. And from that, the questions are similar, I'll say, to what we talk about with the youth, but they're kind of framed in the sense of a parent. And so there is a free or affordable place where my child can be taken if I need it. Some said mostly, so what about under 23% said mostly true, but typically folks said, I don't know. So they didn't understand. Over a quarter of folks really didn't know that if there was a place where they could potentially get services or support for their child in some sort of like emergency or a needs-based situation. And again, these are just questions, so you can't really dig and read too much into the inference of them, but from these questions, we also determined that folks really didn't understand typically how money was spent in local government, maybe in direct relation to child and youth services and resources for parents. So again, interesting finding from there. And I have opportunities to voice my ideas and concerns about decisions that affect my child. Some people felt like a majority felt like they sometimes did, sometimes it was true, but again, we have a large majority that said that either they didn't know or that was not true at all. And so we know that folks didn't understand that there's even ways to advocate for your family, for children, through kind of the public dialogues that we have in our communities. And so we are just a staff of 4, and we did a qualitative analysis of the responses that we got. And typically you do that with a large staff. There's lots of reading and coding. But because we're such a small staff, we determined the best thing to do is we just made a word cloud of all the words that came through. And so you can see more, more. We need more things, more childcare. Children need things. Affordable for families came out a lot. And so this kind of gives you a sense really maybe where the minds of the folks who are taking the survey. There is a need for services for children within cities, within Johnson City especially for this project. And so after we kind of assembled these two, I guess almost three, so we had 2 surveys, and then we had the government analysis. We took that data, and we used that to do kind of guided focus groups with different populations again. And we did community youth meetings. Do you want to say anything about them in particular? Or
Yeah.
just, yeah, please. So she did the youth meetings for us. So.
Okay, so really what we did with this was we took the data that we had from these focus groups and said, hey, these are what your peers are saying. These are their concerns. What do you want to do about it? What next steps can we take? And so rather than just saying, oh, well, youth are saying that their rights aren't being met in XYZ area, I'm going to go find a solution. We wanted to ask the youth, and we wanted to go to the youth and say, what do you want? How can we support you? So that's what we did. So we went to these meetings, went back to Science Hill, and there were a few interesting things that were coming up through this. So in particular, what we had was, again, youth were talking about mental health. And so with that, we wanted to say, but how? What can we do? And they were so excited that somebody was just saying, hey, we want to support you. We want to know. And they were just ready to listen. And so where typically you might say, okay, well, let's advertise more, or let's have more clinics. You thought one of the best ways to support their mental health was to have a free area for adolescents to just be kids. A place where they could go, where economic status was an issue, that was easily accessible in Johnson City, maybe that our transport would get to, so that way anybody could go, it would be free, and it would be just for them. A place where kids, could let go of the thoughts of school and college and what they're gonna do after they graduate, and just have fun, just spend time together. So in doing so, we're seeing these unique ways that youth are finding solutions to the issues that they presented. So that was the largest one that came up. And again, youth were very concerned with homelessness, offering up ideas of maybe the youth could get together and be able to just give back to their community in a way. Maybe we could find funding and we could support them. Maybe we could talk to city government through that route. So youth were finding all these different ways, and now our next steps are, I said, here's what you were saying, the rights that you said were protected and maybe not as protected. Here's how you want to do it, and our next steps are, how are we going to do it? But there were also some other meetings with a different population that Dr. Pettyjohn led.
And then, so similarly, we conducted 3 community model building workshops at the library in Johnson City. That's me. I consider myself fairly technically savvy, even though this was challenging. But I really like doing these models with non-technology items, right? We do whiteboards, we do the big markers, we do sticky notes. We make a mess in the room just talking about like all the different things, all these different factors and how they play and how people think they work together. This was an interesting experience for me. Primarily, I'd done this work previously looking at opioids, and so I'd done this work working with populations of prisoners, populations of folks that are active drug users, people that are in recovery, and so to go out and actually do this in the community was clearly a very different experience, and people just weren't as engaged as some of those other populations that I work with. We really had to work hard to like get people excited about this idea of what we're trying to draw to make changes in our community. We did have some decent attendance though, and from that, looking at those adult populations, we felt the themes kind of matched up similarly in that people were really interested in some sort of community-centered project that would be sustainable, feasible, and inclusive were the big things. We have a fair amount of outdoor space and parks in Johnson City. It's becoming known for some of the green spaces that that we have, but there was a concern that those aren't necessarily directed specifically at the youth. They're for little kids. My little kids love them. We have some things that are more kind of active sports. We have like a mountain bike park, but trying to find an avenue for a place for just kids to be kids, for youth to be youth, is something that did come up from this as well. And so from that, what we're doing now is we're actually taking this to, we work with the City Commission. The City Commission actually presented this idea of going after this, this project initially, and so we've continued to check in with them regularly. And I will say, this is one of the only kind of bipartisan things that our City Commission has all agreed that they enjoy this process, that it's been valuable to the city. We have support across our political spectrum, which is really refreshing and really just shows that folks are in these jobs for the right reason, to really want to improve our city. And so what we're doing now is we're finishing year 2 of this, and so we're working on pitching some potential projects to the city. The city will, through the budgeting process, will assign some budget to those projects, and the idea is to have it implemented by year 4, and then we do evaluation of that project as the last step and see if we're actually making an impact like I talked about. Are we meeting the minimum standards and requirements for a child-friendly city? So after we have our meeting with the City Commission and we turn in our packet back to our coordinators that are in Atlanta, that are overseeing our section of the Child Friendly Cities Initiative, we will be a Child Friendly City candidate, which you get a little sign. It's cool. It goes on. You're, welcome to Johnson City, Child Friendly City candidate. We'll run the project again, like I said, for 2 years. We'll evaluate if we're able to demonstrate any measurable change among our populations or any of those demographic issues that I spoke about earlier. We'll become a designated child-friendly city. We'll carry that for 4 years, and if we like that process, this is something that becomes iterative that you continue to do as a city. And we're looking at the potential, because I'm at ETSU, and so I'm contracted right now for a portion of my time to help the city with this, but there's serious discussion about maybe even putting somebody in the city, that part of their duties would be to continue to make sure that we are like a child's ombudsman or something like that. Part of their duties would be to continue this process and continue to make sure that children's voices are heard. Another area that we're looking into is there is a adult program that Johnson City started called JC 101, and it basically is like, call it like summer camp for adults, but you go to all the different services in the city and you learn about them. So you go to like the dump. I mean, you go to like the water treatment place. You go to see the fire department, the police officers, the SWAT arena. You all the things that maybe you don't know are in a city, and you get to learn about how all these things interact. And it's for adults, and a lot of our civic-minded folks take that, like folks that run for office to do that. But there's a curriculum that exists, and so we've been looking at developing a curriculum for high school students as well, called Gov All Out. And I think, as far as I know, it's going to be launching. And so our juniors and seniors will be taking a class in city civics, basically. And from that, we're hoping to find the kids that are most interested in that process and really work to mentor them to potentially be advocates for youth for the city. And that would be the ideal situation, would be to have essentially a panel of youth that the city could then talk to or have meetings with and take ideas to, and make sure their voices are heard. And so these are things that we're continuing to work on. I wish I could say, we did it, but this is the last slide. We're in this process of doing it. And it's been formative for the city and for me. So I didn't consider myself an advocate for children. Honestly, I was a researcher doing opioids work. I got brought into this, and it's completely changed my thinking about how we should be engaging with our youth to stop those bigger public health problems that come down the line later on. And so my research now is starting to tilt towards doing more of this work specifically with children, and that's not something I thought I'd be doing. I specifically went to public health because I didn't want to be a teacher, because everybody in my family was a teacher. Elementary school, high school, all that, and my big thing was I just teach human anatomy. I was like, I teach human anatomy, that's my one class that I teach, and it's not even like they're college kids. And now I find myself doing focus groups with little kids. I find myself speaking to high schools, and I love it. And so I'm really, really excited to continue to do this work and ongoing. I think we can do questions. If anybody has questions about this process or anything, we'll do our best to answer them. I can't offer you a guaranteed answer. We'll try.